the important thing is getting enough colostrum into it, much more important than how you do it. So these last 12 months, I've thrown the teat away on the bottle and I've tubed every calf. So every calf, when it hits the ground, it gets a full bottle, which is almost 4 litres of colostrum, and I test it with a refractometer. So at least I know what the level of immunoglobulins in it is. The advice, if it hasn't got enough immunoglobulins in it, throw it away, is complete rubbish as far as I'm concerned, because it's still got some in it. It's not rubbish. Give the best, I will give the best colostrum to the most valuable calves, and if I've only got poorer stuff for a beef calf, so be it. It's better than no colostrum. But virtually every calf that's been born, I've physically tubed it with 4 litres of colostrum as soon as I see it. And in the last 12 months, we have treated no calves for scours or pneumonia. They quite often don't drink. If you stick 4 litres of colostrum, they quite often won't drink for 24 hours, maybe 36 hours, but we don't worry about that other than we know they've got the colostrum into them. It's not this, oh, did it drink, did it suck off its mother, what happened? No, we know it's had the colostrum, we know it's got the immunity, they get on with life. Yeah, Johne's is one of those diseases. I've been on the Johne's reduction scheme for 10 years now. They told us when we joined it it'd take 10 years to get rid of it, and we've still got 4 or 5 red cows and just don't seem to ever go where you get rid of 4 and another 4 pop up, don't they? But no logic I can see to how it spreads. They talk about colostrum from cows. I don't think it's colostrum that spreads it, I think it's slurry that spreads it. It's a very frustrating disease. Most other diseases you can vaccinate or do something about it. Johne's is very frustrating to get rid of. We do pull colostrum, which possibly might help, but I'm not. We don't get massive numbers as if we've infected a lot of cows with colostrum, with infected colostrum. Any red cows and yellow cows as well. We calve them separately and keep them away from the replacements, but the majority of them calve later on in the season. We know beef, they're all beef calves anyway, so we don't worry about it so much. We try and do simple things like dipping feet before we go in with the replacement calves and stuff, just to try and avoid spreading it from adult cattle.